A lot of people are dealing with gum disease and don't even know it. There's not a whole lot of indications until it's a little bit too far gone. You're gonna get bleeding gums, you're gonna get pain, you'll start noticing that teeth are loose. But by the time it gets to that point, there's a lot that needs to happen to get your teeth healthy again. It will affect your entire body. So if we're not getting in there and cleaning your teeth and your gums, that bacteria and plaque that they're finding in heart disease patients is the same bacteria and plaque that they're finding in gum disease patients. So generally, if you've got deep pockets and you've got bleeding, we start with a deep cleaning so we can kind of clean things up, see how you're gonna heal. After that, you get evaluated again then to see if we need to do surgery on you. We do a periodontal probing every time you come in. That lets us know if you have any areas that you have inflammation or any bleeding. Then we'll do your cleaning, and with your cleaning here, it's a little bit different than a regular cleaning because we are going underneath the gums. So for someone who's got gum disease, we keep those patients on a 3-month recare appointment. So every 3 months, that bacteria recolonizes and becomes destructive. So the whole plan is to get to that bacteria before it has a chance to get underneath the gums and destroy the bone. We also do implants here. With implants, it's really, really important that you do a good job of cleaning them. The way for an implant to fail is if something gets caught underneath there and you can't get it out of there. We have patients that come to us who have implants from other offices done that they want us to keep an eye on. So the most important thing is just to really get a good evaluation to see where you are at and where you can go to get things healthy.